Think Progress has a piece outlining a new study which focuses on low-income women in St. Louis, Missouri. And what the study wants to look at is if we have a birth control mandate where birth control must be made available to low-income individuals at no cost, does that increase the abortion rate or does that decrease the abortion rate? Now, you might be saying, hold on a second. It's obvious what's going to happen. If low-income women have access to birth control they wouldn't otherwise be able to afford, it's going to reduce the abortion rate, isn't it? And you would be right. The problem is that a lot of so-called pro-life Republicans don't really seem to be seeing it the same way. So this study focuses on low-income women in St. Louis, and it concluded that if you expand access to free contraception exactly the way that the Affordable Care Act will do, you lower rates of unintended teen pregnancy and, of course, as a result of that, abortion. You're not going to believe the extent to which it lowers it. This study found that birth rates decreased among teens who received free birth control, okay, in what's it's called the Choice Project. It reduced from 34.3 births per thousand teens nationwide in 2010 to just 6.3 births per thousand teens. Now, let me say it a different way. It dropped more than 80%. The rate of unintended pregnancy, the rate of teen births dropped to less than 1/5 of what it was before this test was done. 80% lower. Researchers are positive that this would extend to the rest of the nation. There's nothing unique or unusual about St. Louis, Missouri that would make it effective there, but not effective in other parts of the country vis-a-vis Obamacare that would kind of mitigate the significance of these numbers. And it's just amazing. And really, Natan, I'm shocked. I'm truly shocked that this is more effective than, I don't know, pretending people won't have sex if you shame them enough.
Yeah, I mean, this just goes to show that legalized abortion is a good social policy. The question is that one side on one side is people who say what I just said, and on the other side are people that don't care whether it's good social policy. They just think that it's an immoral act that can't be sanctioned by the government.
Well, that's the thing. Conservatives need to be for this. Even if conservatives oppose Obamacare in principle, they should be for making it clear, listen, I may be against Obamacare because of whatever reasons, but the provisions that provide birth control, contraceptives for free, that reduce abortion must be maintained no matter what, because otherwise it would be hypocrisy. I know we've never seen hypocrisy from the right before. Religious conservatives, are we used to seeing hypocrisy from them? I think we know the answer to that. What will the right-wing spin on this be? Without Obamacare, there wouldn't be abortions in the first place? I mean, how absurd, how outrageous will the spin have to be to explain away these numbers? And if the Republican Party, if religious conservatives, which are mostly Republicans, say that this is a bad thing, it must be because their real goal is not to prevent pregnancy. It's not to prevent abortion. It is to control women, something we've seen them do for a long time, isn't it, Natan?
Yeah, I think if you told a pro-lifer that the policies they support are going to lead to more abortions happening, which is clearly what nobody wants, they would just answer that, what they're trying to do is convince people to just, put their kids up for adoption once they're born. And if there really were excellent ways of getting adopted kids into great life situations, you could at least consider that. Of course, it's still controlling women's medical decisions, and I totally agree with the pro-choice position. But you could see how they would, rationalize and say that, it's not that if you follow their road, you're going to lead to more abortions. It's just we need to convince people not to have the abortions.
Right. And listen, this is good for poverty. If you let women avoid pregnancy if they want to for long enough to get an education, that is a positive influence, right? That's going to reduce poverty. This is good from a spending point of view. Birth control is way cheaper than the cost of servicing unintended pregnancies, especially if it involves a mother who didn't have the money for birth control in the first place, especially if it's someone who doesn't have health insurance and it's going to be picked up by the government. Just makes perfect sense.